Jacob was very young when his life would be changed forever. When Jacob was 3 years old, his mother noticed that Jacob easily bruised, specifically on his arms and legs. He got petechia, which were red spots on his arms and upper torso. He noticed he had pale skin, dark bags under his eyes, was always tired, and had an ear infection that wouldn't go away. She brought him to their local hospital, where he was told to go to Fargo. There they met up with Dr. Kabrinsky, where they did some blood tests. They found his platelet, hemoglobin, and white blood cell counts were much lower than they should have been.
So Jacob's journey with acute lymphocytic leukemia started on April 25th of 2001. He was 3.5 years old. I was his nurse that day when he came to the hospital. He was diagnosed that day with ALL, acute lymphocytic leukemia, and started treatment for his disease 2 days later on April 27th. The typical treatment for ALL lasts between 2.5 and 3.5 years, and Jacob finished his treatment in June of 2004 for his first go-around with his disease. He actually tolerated treatment very well and did not have many complications during that time.
Acute lymphoblastic leukemia is a leucine zipper, which is a protein with two alpha helices that are held together by hydrophobic bonds. It binds to the major groove of DNA and stimulates transcription, so it makes more infected cells. ALL specifically binds to the cells in bone marrow, which is the major producer of all blood cells.
So instead of replicating in a very timely and in a very organized manner, particular cells, the cancer cells, the malignant white blood cells, start to replicate very quickly. They push themselves out into into your blood system. When they're immature and they don't know what their job is, they take over, and because your bone marrow is so busy making all these cancer cells, it can't make the proper cells, so your bone marrow stops making red blood cells and platelets and plasma like it needs to, because it's just kicking out cancer cells now.
In general, leukemia is one of the most treatable forms of cancer. The overall survival rate for ALL is about 85%, but ranges from about 75 to 95% based on the type and the risks.
Hi, my name is Jacob, and I was diagnosed with cancer when I was 3 years old. I had a few relapses and stuff around to carry chemotherapy when I was going through my treatments. After a successful bone marrow transplant in Mayo, I got to ring the bell, which meant that I was cancer-free and was done with treatments. I'm still friends with my doctors and nurses in Fargo, and I'm glad to say I'm 9 years cancer-free.